another rights-based approach video clip. I am a person with a disability advocating for disability. Please enjoy this video and share among your networks to make the right real.
Welcome everyone. Greetings from Sri Lanka. I'm Manique Gunaratne, who will talk to you today about advocacy initiatives for persons with disabilities in the health sector. At this health conference, it is important that persons with disabilities are also included. I would like to extend my sincere gratitude to the organizers, especially Dr. Dulani Mendis, for inviting me for this presentation. People with disabilities. In the world, there are more than 1 billion of people with disabilities.
Over 1 billion people worldwide have a disability. That's more than 15% of the world's population. Most live in developing countries. This number is expected to grow due to factors such as conflict, aging, stunting, and natural disasters. Persons with disabilities face higher rates of poverty compared with others. They encounter biases and barriers when accessing basic services. When they're excluded, it's harder to escape the cycle of poverty and marginalization. That's why disability-inclusive development plays an important role in the World Bank's goals of ending extreme poverty and promoting shared prosperity. How do we break down barriers and ensure no one is left behind? By enabling Imani to go to school, providing her teacher with the tools necessary to meet her needs, and giving her family access to support services and assistive devices. By helping Lee understand the high-risk situation in the event of an emergency, and fostering a work environment that gives him a reasonable accommodation through visual signage and other devices. When persons with disabilities are included in everyday activities, they can and do participate and contribute to society. Join us in building inclusive, resilient, and sustainable communities for all. Let's start here and learn more.
Let's start here and learn more. There are more than 1 billion of people in the world who live with a disability. And when it's come to South Asia, 24% of South Asian population are persons with disabilities. If I give you a little bit of statistics in Sri Lanka, there are 1.6 million of people with disability in Sri Lanka, and out of that 57% are women with disabilities. What are the importance of healthcare facilities for persons with disabilities? Equitable access to inclusive healthcare facilities ensures that persons with disabilities have access to same healthcare facilities that people with non-disabilities have. Persons with disabilities face a lot of disparities because of non-availability of inclusive healthcare facilities. And because of that, they will have mental health issues and also a lot of difficulties in healthcare facilities. Human rights approach. Healthcare is a right of persons with disabilities and a fundamental right as well. United Nations Convention on Rights of Persons with Disabilities, UNCRPD, clearly states the right to health for persons with disabilities. When healthcare facilities are improved, persons with disabilities are more likely to receive healthcare facilities like early intervention, early diagnosis, appropriate treatments, and this will lead to overall quality of life. It will bring social and economic benefits. This will enable people with disabilities to live more independently. Ethical responsibilities. This will have equality and respect for diversity. What do you think when I say disability? It's a broad concept. When you say disability, it's barriers and impairments coming together. Impairments, then the barriers. What are the barriers that we face? Environment, attitudes, institutions, disability, that is lack of participation, and when you remove those barriers, we can create an enable society. When the barriers are removed, full participation and equal opportunities are there. According to the classification of the World Health Organization, when it's come to impairment, it can be long-term health condition or chronic illnesses. It can acquire during pregnancy or maybe later on in life. Then comes the barriers. There are environmental barriers, physical environment, transportation barriers, communication barriers, information and communication system barriers, product and services. Then also comes attitudes of people in the society, stigma and stereotype, registrations, public programs and projects, internal policies, organizational procedures. Due to all these barriers, people with disabilities will have difficulties in accessing healthcare facilities. Let's see what are the barriers that people with disabilities face in the society.
0.00.
We asked people with disabilities from different countries to share their experiences of accessing health services. This is what they shared with us.
According to the universal health, everyone has the same rights as others to access health services.
Article 25 of the UN Convention on the Rights of People with Disabilities reinforces the rights of people with disabilities to access the highest form of health care.
I need health services like any other person would need. Like if I have a fever, then I need to go to the hospital. But being a woman, I also need other health services such as visiting a gynecologist for routine checkup.
However, many people with disabilities cannot access healthcare services when they need them.
Especially in the rural areas where we cannot get everything that we need.
We usually face stigmatization in the hospitals due to our disability.
The health workers need to know how to handle disabled patients whenever they come, because their stigma against persons with disabilities is a very serious one.
How accessible is the environment? How accessible is the restroom? How accessible are the beds?
It is not easy. Sometimes to access an ambulance is too hard.
And also access to healthcare is very expensive for persons with disability.
Because once you don't have money in the hospital, nobody will help you.
So imagine a girl or a woman with disability who has no access to any form of health insurance or medical insurance and have to rely on the caregiver to, pay her bills, her medical bills. It's, she cannot make decision for herself. The decision comes directly from the caregiver who is paying the bills.
They need to understand that I can speak for myself.
Yeah, many of the barriers are due to lack of inclusive policies.
It's time for this to change.
The rights of people with disabilities to enjoy the highest standard of health must be guaranteed.
Access to health insurance for women and girls with disabilities. Access to free medical attention.
The doctors should be trained in a way that how to deal with people with disability and also with women with disabilities.
And people like me.
Like me.
Like me. Like me.
Need to be included in the system that decides on the policy matters of our healthcare.
To ensure that we can access the quality and inclusive health services that we deserve.
Leave no one behind.
Let's build together a disability inclusive health sector.
Barriers in the health sector. Physical accessibility facilities are not available for people with disabilities, especially for people with spinal cord injuries. Then communication barriers, especially for people with hearing impairment, because most of the staff members do not know sign language. Attitudinal barriers on how to provide services for persons with disabilities, and also specialized services. Disability is an evolving concept. The United Nations Convention on Rights of Persons with Disabilities, Article number 1, clearly gives what disability is. There are several types of persons with disabilities. We call it persons with diverse disabilities. Vision impaired persons are under two categories, totally blind and low vision. Hard of hearing persons comes under deaf and hard of hearing, and people with disabilities comes under different categories, disabilities in hands, disabilities in legs, spinal cord injuries, little people, disabilities in both hands and legs. Then persons with intellectual disabilities, people who have Down syndrome, autism, hyperactive, slow learners. And when you speak about people with psychosocial disabilities, people who have anxiety and depression. And there are more disabilities such as severe disabilities, multiple disabilities, and people with speech difficulties. Models of disability. Long time ago, everybody thought it's a charity-based model. People can give something and the disability can be overcome. After a few years, it became the medical-based model where people thought through medical care, disability can be overcome. Then became the social model, and now it's a rights-based model for people with disability. It's our right to healthcare facilities. What are the advocacy initiatives that we can take in healthcare facilities? First one is the policy reforms. We must advocate for inclusive policies. What are the actions that we can take? Work with government bodies to have inclusive policies, and also implementation is very important, and partner with international organizations, develop inclusive policies, healthcare guidelines and mechanisms. Training and education. Most of the health professionals do not have proper skill to provide services for persons with disabilities. What are the actions that we can take? Develop targeted training programs, especially for healthcare professionals, medical colleges, nursing schools, and also incorporate disability-specific modules in the health sector. Promote continuous awareness sessions, that is, awareness sessions and sensitization programs are important continuously. Accessible health services. Health facilities need physical, technological and also services to be inclusive. What are the actions that we can take? Perform audits in the health sector so that recommendations can be provided so that in the future healthcare facilities can be improved. Apply universal designs in the health sector, especially in access to built environment, because it's not only people with disabilities use these services, pregnant women, mothers carrying babies, senior citizens, people with temporary ailments, they all get services from the health sector, and also it should be according to universal standards. Must provide access to assistive devices such as visual aids, hearing aids and other assistive devices. Some assistive devices are very expensive. If the governments can provide subsidized rates or tax-free concessions for these assistive devices, it will be really beneficial. Community engagement and awareness. Engage the community so that they will also be sensitized on disability healthcare facilities. What are the actions that we can take? outreach programs to educate the society, launch campaigns on advocacy initiatives in the health sector. And also you must include persons with disabilities in the decision making process. I'm really happy that the organizers of this conference included a person with a disability to speak about advocacy initiatives in the health sector. Research and data collection. We need evidence-based policies and best practices for this purpose. What are the actions that we can take? Conduct studies on disability-related areas in health sector. Gather data which is relevant to the health sector. Use these findings to prepare policies, best practices and projects as well. What are the challenges and barriers that we face in this process? Lack of implementation in policies, cultural barriers, overprotection by the families, and also social stigma plays a major role in these initiatives. Financial constraints. What are the solutions that we can take? Strengthen international cooperation. Ensure sustainable funding to promote advocacy initiatives. Community involvement is also very important. What are the future directions that we can take? Innovations. New technologies like artificial intelligence can be incorporated into the health sector. Collaborations. Opportunities for global partnerships in the healthcare. As discussed, advocacy initiatives are important. If you'd like to join with us in these advocacy initiatives, you can scan this QR code and fill the Google form so that you can be included in our services. I'm really happy that the organizers of this health conference, especially Dr. Dulani Mendis, included a person with a disability to speak on disability advocacy initiative. That's the correct step that the health sector should take. We always say nothing about us without us. So include people with disabilities whenever you take decisions. And if we go one step further, I can say nothing about us. Please join with us so that all of us can get together. Please join hands with us to change from sympathy to empathy, dependence to independence, segregation to integration, and exclusion to inclusion in the health sector to create a disabled-friendly environment with dignity and justice for all in the health sector. Thank you very much.